Hi everybody, I am going to talk about the visual impairment. Vision is one among the 5 senses of an individual, and though vision is associated with eyes, it is part of a complex system of which eyes are just one part. Eyes receive the visual stimulus, which is then received and interpreted by the brain, and then the information about the stimulus reaches the individual. Vision is indeed a complex process that involves different parts, especially the brain, which plays a major role in the processing of the visual information. Visual impairment occurs when this whole process is disrupted and the brain becomes unable to synthesize what the eyes see. It does not always result in complete absence of sight, but sometimes partial vision, which could be corrected with the assistance of a device. Such a person with reduced vision is not labeled as blind. In August 2014, World Health Organization brought out the fact sheet about visual impairment that said 285 million people are estimated to be visually impaired worldwide, out of which 39 million are blind and the remaining 246 million have low vision. Though being blind and having low vision are two entirely different things, it is considered as the same by the general public. It is comforting to know that the number of people visually impaired from infectious diseases has greatly reduced in the last 20 years, but there are still miles to go. Also, it is important to note that 80% of all visual impairments can be avoided or cured. At the end of this talk, you will develop adequate knowledge about various definitions, understand the causes of visual impairment, and learn the management and role of social worker. Let me briefly explain the definition of visual impairment. According to the Persons with Disabilities Act 1995, as well as under the National Program for Control of Blindness, blindness is defined as a condition where a person suffers from total absence of sight or visual acuity not exceeding 6/60 or 20/200 in the better eye, even with correction lenses, or limitation of the field of vision subtending an angle of 20 degrees or worse. The visual acuity as well as field of vision has been considered for deciding the blindness. Low vision is recognized as a category of disability and defined as a person with impairment of visual functioning even after treatment or standard refractive correction, but who uses or is potentially capable of using vision for the planning or execution of a task which appropriate assistive device. In the guidelines for evaluation of various disabilities and procedure for certification, the Ministry of Social Justice and Empowerment India mentions that low vision refers to a person with impairment of vision of less than 6/18 to 6/60 with the best correction in the better eye, or impairment of field in any one of these categories, such as reduction of field less than 50 degrees, hemianopia with macular involvement, and altitudinal defect involving lower fields. National Sample Survey Organization defined visual disability for its 58th round survey as a loss or lack of ability to execute tasks requiring adequate visual acuity. According to this survey, visually disabled included persons who did not have any light perception, both eyes taken together, and persons who had light perception but could not correctly count fingers of hand with spectacles or contact lenses if he or she used spectacles or contact lenses from a distance of 3 meters in good daylight with both eyes open. Night blindness was not considered as visual disability. World Health Organization defines blindness as the inability to see. The working definition of low vision, according to World Health Organization, states that the person with low vision is one who has impairment of visual functioning even after treatment and or standard refractive correction, and has a visual acuity of less than 6/18 to light perception or a visual field of less than 10 degrees from the point of fixation, but who uses or is potentially able to use vision for the planning and or execution of a task. These definitions emphasize the points that when the person is with significantly reduced vision, his or her visual performance is affected, but still he or she can use the vision. This point is very important because in case of usable vision, training to use that vision might be possible. In addition, this person is not labeled blind. According to the International Classification of Diseases, there are 4 levels of visual function, namely normal vision, moderate visual impairment, severe visual impairment, and blindness. Moderate visual impairment combined with severe visual impairment is grouped under the term low vision, and low vision taken together with blindness represents all visual impairment. The prevalence of visual disability in India can be examined over the national sample surveys in the past. The prevalence of visually disabled persons has first shown a marginal drop from the year 1981 to 1991. Thereafter, there has been a sharp dip in their proportion in the year 2002. The reduction in the proportion of visually disabled has been significantly more in rural sector as compared to its urban counterparts. However, as per the Census Survey of India 2011, the number of visually disabled persons was 50,32,463, and of this population, 26,38,516 were males and 23,93,947 were females. There was a change in the definition of the visually disabled between the Census Survey of 2001 and 2011. One-eyed persons were treated as disabled at Census 2001. At the Census 2011, such persons have not been treated as disabled in seeing. At the Census 2011, enumerators were asked to apply a simple test to ascertain blurred vision. At Census 2001, no such instructions were given. Night blindness was not considered as visual disability. Out of the total visually disabled persons, more than 70% were blind and nearly 30% suffered from low vision. The overall proportions of blind and low vision among the visually disabled remained more or less the same across sectors and sex. Globally, the number of people of all ages visually impaired is estimated to be 285 million, of whom 39 million are blind. Let me discuss the causes of visual impairment. Visual impairment is a major global health issue, as the preventable causes are as high as 80% of the total global burden. The major causes of visual impairment are uncorrected refractive errors and cataract. In spite of the progress made in surgical techniques in many countries during the last 10 years, cataract remains the leading cause of visual impairment in all areas of the world except for the developed countries. Other main causes of visual impairment are glaucoma and age-related macular degeneration, corneal opasities, diabetic retinopathy, childhood blindness, and trachoma. These are the causes of avoidable visual impairment worldwide except the age-related macular degeneration. In India, the National Sample Survey reveals that old age is a major cause of visual impairment in the rural areas, whereas cataract is a major cause in the urban areas. Almost 50% of visual impairment, both in rural as well as in urban areas, is caused due to old age and cataract. The causes of visual impairment are classified as ocular diseases and anomalies, general and systemic diseases, and injuries and accidents. Let me discuss each of these classifications. First, ocular diseases and anomalies. There are different types under this classification. Rubenthal knows it is infantile glaucoma, one of the rarest conditions in children. As infant's eye is elastic, increased eyeball pressure causes the eye to enlarge. It occurs mostly due to failure of development of tissues in region of anterior chamber. It results in excessive watering and photophobia, and cornea becomes cloudy. Due to the altered shape of eye, refractive errors may occur. Albinism. This is a hereditary condition involving defective development of pigment in hair, skin, and eye. In ocular albinism, only eyes are affected. The amount of pigmentation may increase slightly with age up to adolescence, and that results into improvement into visual acuity. Retinitis pigmentosa. This is a hereditary slow degenerative disease of the retina. The condition affects the peripheral area of retina, including rod cells. It may result into night blindness, tunnel vision, and inability to see in dark. Retinoblastoma. This is malignant tumor of the retina. It is generally confined to infants, probably always congenital, and in some cases are hereditary. It is often a bilateral condition and both the eyeballs may have to be removed. Retrolental fibroplasia. It is associated with children born premature who have been given high concentration of oxygen. It is caused due to formation of new vessels and proliferation of fibrous tissue in the retina. As it results into formation of a membrane in the back of the lens of the eye, vision is fragmented. Retinal detachment. It refers to separation of the retina proper from its pigment epithelium layer. From the clinical point of view, it is divided into two classes: Secondary detachment is due to an obvious mechanical cause subsequent to other happenings in the eye. Simple detachment is due to development of a hole in the retina. It is caused by degenerative myopia, diabetes, diabetic retinopathy. It leads to painless loss of vision, appearance of flashing lights, visual field loss, and decreased visual acuity. It is generally treated by laser surgery and cryosurgery. Diabetes mellitus. It is a hereditary disorder and affects retina. It is also known as diabetic retinopathy. It leads to fluctuating vision, loss of color vision or visual field, refractive error, decreased visual acuity. Trachoma. It is a chronic contagious disease of the conjunctiva and cornea caused by an organism, Chlamydia. The primary infection affects conjunctiva and follicles, and corneal involvement causes ulcers. Glaucoma. It is caused by an obstruction in aqueous outflow channels at the angle of anterior chamber. It also results in the rise in intraocular pressure, which is detrimental to the eye. It is usually a hereditary symptomatic condition. Cataract. In Latin, word cataract means waterfall that explains the appearance of the eye when lens becomes cloudy and opaque. It refers to the loss of transparency of the lens due to altered physiochemical processes within tissues. It is usually associated with advanced age. If it is present at birth, it is referred as congenital cataract. The second classification is general and systemic diseases. Many general and systemic diseases that affect the vascular and metabolic systems put the eyes at risk. Major diseases which may result into visual impairment are hypertension. Vascular retinopathy is associated with raised blood pressure along with pronounced degenerative changes in the retinal vessels. The circulatory changes lead to development of retinal edema. 2. Vitamin A deficiency. Vitamin A is essential for the buildup of the surface tissues in our body, including eye. Vitamin A deficiency may lead to corneal damage, ulceration, and blindness, particularly in combination with measles or malnutrition. 3. Chronic diarrhea. It is a cause of blindness in rural areas. Generally, loss of vitamin A leads to softening of cornea, which results into keratomalacia. 4. Multiple sclerosis, thyroid gland disorders, certain vitamin deficiencies, and other systemic diseases can lead to eye problems with vision loss. The third classification is injuries and accidents. Injuries, accidents, and poisonings account for many known instances of visual impairment among school age groups. Actually, injuries and accidents are not considered a major cause of blindness, since technically both eyes would have to be severely affected. The injuries are a major cause of preventable, curable, and monocular visual impairment. Let me discuss about the management of visual impairment. In case of visual impairment, early eye examination is of utmost importance. Most of the cases of blindness can be prevented if problems with vision are identified and treated at an early age. The UNICEF has identified a few signs that might be indicators of visual impairments, and it can be checked by parents in case of doubts about the child's vision. There are some general symptoms that may occur from birth. The child squints or blinks when looking at something. The child's eyes are crossed. The child favors one eye more than the other when looking at an object. One or both of the child's eyes turn in or out. The child's pupils are hazy. The child's eyes are welling up with tears excessively, or red, or the eyelids are encrusted with matter. The child turns or tilts his or her head abnormally. There are many visual aids available for visually impaired people. They are such as learning equipments like arithmetic frames, abacus, geometry kits, and so on. Giant braille dot system for slow learning blind children. Dictaphone and other variable speed recording system. Tape recorder for blind student after 12th standard. Science learning equipments like talking balances, talking thermometers, measuring equipments like tape measures, micrometers. Braille writing equipments including braillers, braille shorthand machines, typewriters for blind students after the 12th standard. Talking calculators, geography learning equipment like erased maps and globes. Communication equipments for the deaf blind. Braille attachments for telephone for deaf blind persons. Low vision aids including handheld stand, lighted and unlighted magnifiers, speech synthesizers, or braille attachments for computers, and special mobility aids for visually disabled people with muscular dystrophy or cerebral palsy like adapted walkers. There are many voluntary organizations working in the field of visual impairment that help people lead a normal life like any other person. The largest is civil society effort to prevent and cure blindness and rehabilitate people who are irreversibly visually impaired or blind is the Sight First program of the International Association of the Lions Club. Among others, this program supports the largest initiative to develop child eye care centers, which is implemented in partnership with the World Health Organization. Social workers believe that individuals who are visually impaired are not a liability to the society. They can work in creating awareness towards the prevention of blindness in early identification and intervention services. They can help the persons with visual impairment to avail the assistive devices and provide psychoeducational assessment and rehabilitation, including community-based rehabilitation. Social work interventions are generally initiated to strengthen human functioning and to enhance the effectiveness of societal structures that provide resources and opportunities for the clients and beneficiaries of services, including people with visual impairments. The persons with visual impairment can lead almost a normal life with the proper training and by using the assistive devices. Let me sum up. Vision is indeed a complex process that involves different parts, especially the brain, which plays a major role in the processing of the visual information. Visual impairment occurs when this whole process is disrupted and the brain becomes unable to synthesize what the eyes see. According to the International Classification of Diseases, there are 4 levels of visual function, namely normal vision, moderate visual impairment, severe visual impairment, and blindness. Blindness is defined as a condition where a person suffers from total absence of sight or visual acuity not exceeding 6/60 or 20/200 in the better eye, even with the correction lenses, or limitation of the field of vision subtending an angle of 20 degree or worse. As per the Census Survey of India 2011, the number of visually disabled persons was 50,32,463. Individuals with visual impairment do not get equal opportunities or options in life due to their disability. The major causes of visual impairment are uncorrected refractive errors and cataract. In India, the National Sample Survey reveals that old age is a major cause of visual impairment in the rural areas, whereas cataract is a major cause in the urban areas. The causes of visual impairment are classified as ocular diseases and anomalies, general and systemic diseases, and injuries and accidents. In case of visual impairment, early eye examination is of utmost importance. Most of the cases of blindness can be prevented if problems with vision are identified and treated at an early age. The UNICEF has identified a few signs that might be indicators of visual impairment, and it can be checked by parents in case of doubts about the child's vision. There are many visual aids available for visually impaired people. Social work interventions are generally initiated to strengthen human functioning and to enhance the effectiveness of societal structures that provide resources and opportunities for the clients and beneficiaries of services, including people with visual impairments. Visually impaired people can lead almost a normal life with proper training and by using the assistive devices. Let me sign off now and hope to see you in another session. Thank you.